Hi, Tarek, and hi, Karen. It looks like your audio is still getting connected, so we'll just wait another second here. All right, well, it looks like your audio is still connecting, Karen. Hopefully you can hear us, but we'll go ahead and get started. My name is Brianne Lott. I'm a Global Career Initiatives Coordinator at Career and Professional Development Services. Just want to thank you for attending this session today, Health and Wellness, Career Interest Community Trends. I have 3 of my colleagues with me today who will be delivering this presentation. So Beverly Johnson, Eduardo Alonso, and Olivia Fallon. And so before we get started, just gonna briefly say that we are recording this meeting. So if you miss any parts or want to rewatch it, I'll send out the link to the recording early next week. So be on the lookout for that. And then also you are currently muted. So if you do have any questions or comments throughout the presentation, please do use the chat function to enter those in. We'll be monitoring that throughout, so feel free to ask questions at any time, and then we'll also leave some time at the end of the presentation to have a question and answer as well. So without further ado, I will hand it over to my colleagues for the presentation on Health and Wellness Career Interest Community Trends. Thank you.
Awesome, cool. So let me just go ahead and share my screen. Great. So today we'll be talking a little bit about the career interest community, health and wellness. So if you're not familiar, CICs are essentially sort of like an industry focus on different areas. So we have health and wellness, STEM, sustainability, and sort of everything in between. But today specifically, we'll be elaborating a little bit more on just different opportunities available, some of the trends in health and wellness, how you can be more competitive, and all that good stuff. So just a couple objectives as far as the outline of our presentation. We'll go over what is health and wellness. I know that's a very broad term. Additionally, we'll talk about some trending careers. What are the careers that are most in demand right now? Preparing for success and tips regarding that. Life after undergrad, some employers that are specifically hiring in this industry, and also industry highlights. And then we'll briefly touch on Innerstrike. As I know we just had a presentation on that before this one. And I'll turn it over to Lalo.
How's it going, everyone? My name is Lalo, Eduardo, but I go by Lalo, so it's fine if you want to use either or. So we are a small enough group here where we would like to engage with you as much as we can. And if there are some background noises in your surroundings or anything like that, don't feel like you have to unmute yourself. So please, one thing that we would ask for you is to share what is your major, hometown, and maybe a fun fact about yourself that you would want us to know. And basically this is going to help us know who you are, what may be some of your interests, and basically tailor the information that we're going to give you in the next couple of minutes as much as we can, so you can get the most out of it. All right. So if you want to use the chat box, go for it. We'll be reading those here shortly.
And we can go ahead and introduce ourselves as well. So all 3 of us work as career and industry specialists. When I was in college, my major was human services. And then I attended Clemson for grad school. Hometown, I'm from Roanoke, Virginia. And a fun fact would be that I've never been to California. So yeah, what about you, Lala?
Yeah, okay, yeah, I can go next. And I think we have a next slide with some of that information if you want to read it.
You're right, wow.
But yeah, like I said, my name is, I go by Lalo. I'm originally from LA, and the fun fact that I put on there is that in high school, I didn't actually start playing sports or anything like that until like 7th grade. But then once I started high school, I was involved in after school programs. And one day the football coach decided that I was going to try out for the team, even though I didn't even know what football was. I knew it was a sport, but never knew anything about it. And I guess I was athletic enough to make the team without even trying. In my first year and a half, I didn't know any of the rules. They just threw me out there and said, "Hey, this is football. Go do this, block this guy, run the ball here." And that's basically what I did, because I know football can be complicated sometimes, but I got by.
That's amazing. And I'm Beverly Johnson. I'm also a career and industry specialist. I'm from right here in Glendale, Arizona, where I still live and work. I did live in Michigan for a while as well. And the fun fact about me is that I earned a bachelor's of social work, and I was super passionate about going into social work, but I only made it in the field for about 1 year and 7 months. And then I hightailed it back into human resources and then ended up here. So that's just representative of a lot of what we're going to talk about today, and why career interest communities are important over just aiming for one single career. Moving right into an overview, or did we get responses in the chat? Let me check that. Yes, thank you so much. Good to see you. All right, so very interesting. So Science and Healthcare Delivery Masters at ASU from United Arab Emirates. Thank you, Shrek, for sharing. And then, so an overview of the Health and Wellness CIC, it does encompass all of those healthcare majors, as well as a lot of other fields. So when we talk about health and wellness, it also includes health coaching, nutrition, public, global, and community health, sports medicine, and even health policy. So whether you're interested in working like directly in the medical field, or you want to work in the administration of an organization, or even with some of these like health and nutrition focuses, this is the right CIC for you. So the career interest community model is helpful because it really helps you to expand your options. We find that a lot of the time too, students will start, in their undergrad program with a really clear idea of what they think that they want to do. But then once they get into their courses, or maybe have some internship experience or things like that, that it's not exactly what they thought that it was. But it doesn't mean that the education and experiences they've had so far don't stand for anything, because if you look at the career interest community as a whole, there are a lot of other options and places to use those knowledge and skills. So it helps to be able to explore many careers in a field and then remain open to additional experiences. And so if you don't mind, Olivia, just clicking briefly on the handout link there in the bottom corner. These handouts are available for each one of the career interest communities that we have here at ASU. And on them, you'll find an overview of what that community encompasses, a list of potential occupations, and that's not all encompassing by any means. It's just a list of ideas, some ideas on how to be competitive, and then these are lists of organizations, both student organizations that are available at ASU, and then professional associations outside of ASU that we recommend that you get involved with, early in your college career, so that you have that extra experience and networking opportunities within the fields as well. Thank you, Olivia. Okay, so now that we have chatted about that, we were interested to know if there's a career specifically, or maybe a couple of careers that you're interested in. And also, I'm really curious to know what the scariest profession known to man even is. So if you don't mind putting that up there, I would love to see it as well, Tarek. Ah, dentistry. Okay. So that's where you're headed. And is that the scariest profession known to man? I mean, I know a lot of people are afraid of the dentist, but that's interesting. I like it. So yeah, go ahead.
Hello, can you hear me?
Yes.
Yes, I'm Tarek. I'm a dentist. Yeah, it is a very scary profession. People come to me from all kinds of backgrounds, and they're really scared of that visit. So, anyways, I've decided a while ago to have like a career switch. I'm trying to become a healthcare professional. I'm trying to understand healthcare policies on a bigger level, and I'm trying to affect them to solve the complex problems in healthcare systems around the world. So that's why I'm here.
Well, that's amazing. And that is actually a really cool example, because both dentistry and like healthcare policy would fall in this career interest community. So very great, very good examples. And then Karen, if you're on and you can hear, you're welcome to share as well. You can go ahead and post your comments in the chat or speak up directly if you prefer. So these are just some examples of how the different career interest communities can kind of work in concert together. I know, Tarek, that you had mentioned that, you want to affect policy. Health and wellness and public, social, and human services might be like a good combination of things for you to be interested in. But here you can see, again, all of our CICs here at ASU. So like the worksheet that we just spoke about, these presentations, for each one of the career interest communities, we have additional information and specialists that can talk to you about your selected CIC. So these are just some examples. And I believe that is it.
Awesome. So yeah, in CICs, we always like to say that careers are non-linear, meaning oftentimes when I work with students, they'll ask like, what can I do with this major? In fact, I just had that conversation earlier with a student. She was like, if I major in psychology, what options are available? But the reality is, with your major, that can be applied to a number of different careers. Rarely is it linear unless you're in a field like engineering or nursing. So those are some of the caveats, of course. But I would say the majority of majors don't directly equal a career. The reality is that your major plus your, plus your experiences, plus your work values, passions, interests, identity, got too carried away, all equal a career, job, personal fulfillment. And so an example I like to give is when I was in college, like I said, I got a Bachelor of Science in Human Services. And I kind of had that mind frame of like, what can I do with this major? But I quickly realized through internships, through reflecting on my own personal work values, I thought I wanted to become a counselor or work in a nonprofit. And then I quickly realized that wasn't the work environment I wanted. And I ended up shifting gears a little bit and pursuing a career in higher education. So I think that really goes to show that your life experiences really shape that path. And if you're in the boat of maybe you're passionate about a major, but you're not exactly sure what career, that's totally, normal and pretty common. So preparing for success. So as mentioned, internships are one of the greatest ways to figure out what it is you're interested in. I know you mentioned you're interested in dentistry, as well as just being a healthcare professional. And I think having those internships can help just affirm your passions, as well as just make you more marketable, honestly, when it's time to graduate. Additionally, shadowing is very helpful and important, particularly if you want to become like a doctor or work, in any like physician assistant, anything like that. Typically speaking, admissions committees want to know you've really done your research and have experienced what that work environment will be like, so that you're not signing up for this really demanding medical school load if you're still not positive. Research experience is great. So, researching with a professor, just getting some research experience under your belt is helpful because you're going to do a lot of that in graduate school. Mentorship. So we actually do have a platform called ASU Mentor Network. And that's essentially a website where you can even get like flash mentoring. It doesn't even have to be like a sustained mentoring relationship, but rather just connecting with someone who you want to learn more about and kind of glean from their experience. Networking with faculty, as mentioned, this is especially important if you do want to do research, or if you're in a field where you're going to need recommendation letters. It's really helpful to maintain those relationships with your faculty members. Explore parallel career paths. So every now and again, we'll work with a student I'll work with a student who's dead set on medical school, which is great, but it's also really helpful to think about other options as well, considering medical school is ridiculously competitive. So that's definitely helpful. And then certification. So whether that be CPR certified or what have you, it's always just makes you more marketable to pick up some of the certifications along the way. So this is our list of career competencies. So essentially the National Association of Colleges and Employers, also called NACE, surveys employers throughout the United States each year and basically asks what are the top skills you're looking for in your new hires. And so maybe you're in the boat of maybe you do know what you want to do, but you're like wondering what skills you should be developing in the meantime. This is a great list to start with. So problem solving and critical thinking, written and verbal communication, leadership, digital technology, career management, teamwork and collaboration, professionalism and work ethic, and global and intercultural fluency. So maybe, for example, you don't feel as strong of a leader, maybe consider joining clubs where you could be treasurer, vice president, president. All those are good things to be working on and will definitely just, again, build you as a professional and also make you more marketable. And I think this is me as well. Okay, so how do you become career ready? So as mentioned, joining clubs and organizations are really helpful. One of my friends was really wanting to focus on his public speaking abilities. He was an international student and wasn't as confident in public speaking or his English speaking. So he ended up joining a Toastmasters club where basically you do a lot of speeches. And that was proven to be very beneficial for him. Additionally, part-time jobs, class projects, service learning, internships, kind of everything we mentioned. Community service is a great thing to consider, as employers like to see you're well-rounded, you like to give back, and just care about your community, of course. And then the career development process. This is essentially sort of a wheel to look at when you're thinking about your different career interests. So first, starting off with understanding what your interests are and what career options fit. Know what it takes to be competitive. So sometimes it's helpful just to look at sample job descriptions and see what those requirements are. How are you developing your competencies or transferable skills? Do you have enough experience to get a position in the field? So again, that goes back to looking at job descriptions, see how many years they're looking for in their new candidates for even entry-level jobs. And then what is your search strategy? And that's it for me.
Yeah, so with all of this information, I know that sometimes it can seem like a lot. How do I actually reflect my experiences and what I've learned through the last couple of years or my professional and academic career into this application materials or into my new network. So we want to know more about what is it that you have done in the past in relationship to maybe internships, networking opportunities, or different clubs around the university that will come in handy when you look for some of these opportunities. And I think we have something in the comments here. So Derek, I know that you said you're trying to find a remote opportunity, an internship. So we'll talk a little bit about how to find different opportunities. One thing that we are seeing, especially due to our current situation, there are some organizations who have continued to promote their opportunities and continue their hiring practices. Some of them, I don't want to say continued as normal, but are still in person. Some of them have transitioned more to an online platform and remote work. So we'll go over some of that in a second. And if you are, so the other thing, Tarek, that I see is that you're trying to establish a connection with your healthcare professionals on LinkedIn. That is great. If we have a few minutes, we'll definitely show you some of the resources that you can take advantage of, not only on LinkedIn, but the ASU Mentor Network. And some of the highlights that I want to make sure that you get is, if we can go to the next slide, please, is some of the organizations and positions that are in high demand right now. So here you'll see some of the places that we continue to hear from are looking for recent graduates and alumni. So search in the healthcare is higher. Demand for traveling positions is definitely one of the things that you can look at, and this may be very specific to certain roles. But if these are some of the things that you're looking to get into, these are things that are in high demand. So not all of them are going to require you to have a quote unquote clinical background. Things like meditation that are more from the wellness perspective, and how do you make sure that you take care of yourself mentally, and you know how do you respond to different stressors. Those are also areas that you can go into and have an effect within health and wellness. Some of the top employers that we're currently seeing engage in the university are the following: so Logistics Healthcare Incorporated, Thermo Fisher Scientific, Americares. And one thing that I do want to make sure I highlight is that within these organizations, yes, they may be looking for students or alumni who have a background in specific degrees. Maybe it could be clinical, it could be non-clinical, and then more so from the wellness aspect. But also, if you're interested in business, sales, if you're an engineer, if you come from a marketing background, you never thought about going into the healthcare industry, these are companies who are still looking for those positions that are not necessarily from the standpoint of healthcare professional to patient interaction, but more so as a whole. And the next slide, basically this right here, are some organizations that we have established connections with that have OPT and CPT opportunities. So we know that during the fall and in spring, we have career events where you have the chance of networking with different organizations. And when you check in, there's always that barcode or that QR code that you can scan, and it will give you a list of organizations who have identified themselves with having different opportunities for OPT and CPT. So I want to make sure that as it relates to healthcare, you are aware of these companies: Scribe America, Boston Children's Hospital, Mom Doc, Aetna, and CVS, Honor Health, HIPAA, StretchU. These are the companies that we see post the most and have a wide variety of opportunities for you to apply to. Now for trending careers, Tarek, you're probably familiar with this: dentist, physical assistant, orthodontics, nurse practitioners, physician, speech language pathologist. Those are all careers that if you see or if you're familiar with them, you may think more of them as the clinical or direct healthcare interaction. As to for the wellness aspect, you can be studying or interested in nutrition, healthcare coordination, community health. Tarek, one of the other things that you mentioned, you want to have an impact on the policy side, on how to better services for communities. That's also within this health community interest. So you can approach it from a lot of different angles, not only from the patient to professional angle. Now, additional CPT and OPT roles. I know that in the previous slide, I just showed you companies that that are hiring with these different opportunities. Now, I wanted to make sure you also had an idea of what are some of these roles that the companies are hiring for. Not necessarily in the clinical setting or in the policy side, but also, as you can see on here, these companies are looking for engineers and people who manage their data. Looking for pharmacy tech if you are interested in going into pharmacy. If you're interested in going into human resources, that's another thing that they're looking for. Business analytics. So even for students who may be in the WP Carey School that never thought about going into health and wellness and helping people in that way, you definitely have the chance of going into this healthcare. You have the chance of going into these healthcare organizations and have an impact, still using your educational background in that way. So don't think that the health and wellness industry always just encompasses specific degrees. Regardless of your degrees, you can always have an impact in this way. And now time for Innerstrike. So I'm curious to know, we just had a presentation earlier today on Innerstrike. Were either of you part of that presentation, or did you get a chance to hear what our team had to say of this platform? Okay, so Tarek, you are familiar with the platform. I'm glad to hear that. So the other thing that I wanted to highlight is also Handshake. Handshake, all the organizations and positions that I highlighted to you earlier, those are available to you on Handshake, and you are able to filter and find some of these opportunities. So Innerstrike, you can take the angle from working or finding jobs within the US or outside of the US. Handshake allows you to do something similar for organizations that are hiring within the US. And I know that one of the questions earlier was, how do I interact, how do I expand my network if I want to make connections? So I'm going to share my screen here with you in a second to show you a little bit of LinkedIn.
Okay, sorry, give me just 1 second.
Oh, that's fine. I'm going to pull it up right now. And also the ASU Mentor Network. And we also have another presentation on Friday where we're going to be going in depth in both of these platforms. So I'm not going to go too much in depth into what each of these platforms offers, but it's definitely an option if you are thinking of expanding your network. As you can see on here, I am on the Arizona State University LinkedIn page. So this is not an individual per se, but it's more so of the organization. You can always join, look at the different alumni that are part of ASU, and you can search by different locations. So if you are thinking of going outside of the country, you are able to see here where our alumni currently live or have gone to, where they work, and also what they studied. So in some cases, you will see students or alumni who have graduated from a communications background and are currently working for a healthcare industry and communicating with the community and making sure that they raise awareness on different services. So you'll see a variety of different topics when you go through this platform. Now, the other platform that we have is the ASU Mentor Network. And this network or this platform, you can join with your ASU credentials. And you'll see on here, you have a similar approach. So you can go into the different groups, and just as the CICs, you will be able to find a health and wellness group. So we have arts and designs, business, communication, education. So these are the same CICs that we have available to you to join. Once you join the health and wellness group, you can reach out to all the different mentors available to you in the platform, and that is a way to expand your network. So I don't want to give you too much. If you are interested in learning more on how to reach out to some of these individuals, how to make the most out of that first message, that engagement, we will have an extended conversation on networking on Friday. Okay, I'm going to stop sharing my screen now, and I want to make sure that I give you all a chance to ask any questions if you want to learn more about the CIC, networking, or you have any questions about future plans.
I saw we had one question about transitioning. I'm just trying to find it really quick.
Okay.
The question was from Karen. Karen, did you feel comfortable asking the question regarding changing careers during this unusual time?
Can you hear me?
Yes.
Okay. Yeah, so I'm in the health and fitness industry. I work for Lifetime. I coach gymnastics. I'm a gymnastics judge. I've got a master's. But the gyms now are just, they're really going to like a part-time hiring, so they don't have to pay so many benefits so they can stay open. So if you wanted to transition into something else, any suggestions with a background like that? I mean, a lot of us are the same way, especially since there aren't any gymnastics meets. And I also judge college, acro and tumbling and everything. Those seasons are over. And so a lot of us that rely on that income, it's gone. So any suggestions on how to transition into something new? Everything will open up again once there's a vaccine. We get all of that, but in the interim, you know, it's not like you can be a bartender, you know, or get a job doing something like that. So to get back into the professional education industry, basically, and maybe looking into that, how do you transition from working in the public sector, private, going back into education, maybe?
Do you mean education as in like teaching, or can you elaborate on that just a little?
Teaching, coaching within, you know, either high school, college, or some type of sports information managing, anything like that, because obviously somebody with a background in coaching, in strength and conditioning, those types of things, but are good. But in the education area, it seems like you need different certifications, I guess. So how do you transition into that? Because it's not like you're just getting out of college. You've been out there working, you know, you've got the experience, but in the education realm, you do need those other stepping stones, right? So, you know, like in my industry, strength and conditioning, there's a new certification that everybody's getting, but honestly, looking at that, you're gonna spend a year or two studying, because it's more medical based now, like what you all were saying. Any ideas of how you might do that, or, you know, do you just hope to get with a company that might pay for something like that? Because you don't want to go in, you know, these internships, and let's just be honest, are more for kids that are in school right now, up and coming, as they should be. I don't have a problem with that at all, but they're not gonna accept a volunteer position, even with myself, because I know how to do that. So those opportunities are for the kids, basically. I'm a kid at heart, but I'm not, you know. So any ideas, even with the mentorship program that you guys have, again, it's not really for the more advanced, you know, for lack of a better term, individual that's been out there working and now wants to maybe go back into education or something like that. And that's kind of where I am with all of this right now. You know, where do you go?
Yeah, honestly, one of the first things that comes to mind, and I feel like I've worked with a lot of people in career transition with this current COVID season, or pandemic, I should say, seasons. But nonetheless, is doing informational interviews with people that are like in those ideal roles. So on LinkedIn or ASU Mentor Network, like Lalo showed, you can search out just like healthcare field or you know, whatever buzzword you're looking for, and it'll figure out all the different people with that background. And personally, I think one of the best steps you can first take is just reaching out to them and setting up like a 15-minute phone call to just learn more about their career. Are the certifications helpful, at least at their place of work? What other skills do they look for? What are some parallel career paths that aren't exactly theirs, but very similar? So getting that like information on the front end can be very helpful. And also just learning what companies are hiring. Yeah, and I also think when you're job searching on Handshake, on Indeed, particularly on Handshake, you can filter out jobs based on industry. So maybe you're interested in a number of different areas, but you don't know, you know, exactly what career title. I think sometimes it's helpful just to job search on industry and seeing what opportunities are even available, particularly right now. I didn't have anything to add, Lala.
Well, especially my degrees in recreation and leisure studies or tourism, whatever the title is now, but it's basically hospitality. So there's no traveling, you know what I mean? Like right now, and you can't travel to take a position basically because of the restrictions. So I think that takes out, and correct me if I'm wrong, I think that almost takes out an industry.
Tourism, yeah, tourism and hospitality is one of the hardest industries right now. But I think Olivia's right. You do have a lot of options that you might not even be aware of because you're not sure what to search for. So taking it, you know, to the search by industry to just get an idea of some titles in that that are out there, and then take a look at what they're looking for, because you'd be surprised, like you have that 4-year degree plus really valuable experience. You probably qualify for things you haven't even thought of yet, just because a lot of them will say a 4-year degree in this or related field, and that or related field really makes it open to them taking anybody who's a good fit for the position.
Right.
Yeah, we'd be happy to chat with you. Like you could schedule an appointment with any of us and we could maybe demo some of these things for you and kind of like give you some more customized, you know, feedback strategy as well.
Great idea. Good. Okay, thanks. I'll private message. Is that what we do?
On the chat?
If I wanted to set up a one-on-one to make it a little more personable, do I just private email you guys, or how do you set up that?
So all of our appointments are scheduled through Handshake. Do you happen to have an?
I do, and
yeah, I
can't, for some reason, we can't get in. Yesterday, I couldn't get online or anything, and they said there's something wrong with my account, so they'll get back to me.
Oh no.
So I haven't been able to really do any of that. So once that's worked out, then I should do it through the Handshake. Is that right?
Yeah, I'll put my email right now in the chat, so you can send me an email and I can help you as well.
Okay, thank you.
Oh, sorry, that didn't go to you. Hold on one second.
Yeah, and then the one thing that I'll probably add to that is with education in the education field, that is something that there's always going to be a need for, and it's not something that we have seen a decline in need based on our current situation. Maybe the modality of the way that people are going through not only delivering information but going through the hiring process has changed a little bit. But through any of these meetings, if you decide to meet with Beverly, Olivia, or I, we'll look at positions that you probably be qualified for based on things that we have seen in the past. And when submitting your application is what is the most relevant experience that you want to put forward into your resume, into your cover letter, to give the organization a reason, an understanding of why is it that you're making that shift, and how it is, again, going back to the skills that you have learned, how is that going to help you transition over into a new industry, for example. So yeah, that is something that we can always definitely do.
No, thank you. I really appreciate that. And I will follow up.
Awesome. And I know we have also a question from Tarek. Perspectives for being a healthcare professional post-COVID-19. Any suggestions? So I think there's definitely, I mean, there's always things changing on an almost daily basis as far as recommendations to follow. But I think depending on the area that you're going into, one of the first things that I would probably anticipate changing is the regulations, and making sure that, for example, the food industry is being well protected, and that, for example, one of the things that I've heard is that there's always a need for people with a nutrition background to assess the way that restaurants are providing their services, making sure that everything is up to code. So if you're in the compliance field, there's probably going to be an increase in need for that, and making sure that the new regulations are put in place. I'm not sure if that's exactly what you mean. There's a wide variety of things that we can talk about post COVID-19. And the second question is a doctoral program, such as the Doctor of Behavioral Health, worth it in a healthcare career? The only thing that I would say with this, probably we'll still want to meet to talk more about what you mean by worth it. Always the chance of you learning more and having the ability to increase your professional development through a doctoral program. Now, there's a lot of factors that you probably want to consider from your personal perspective and professional goals that will come into play to know that it's worth it for you as an individual. And I don't want to tell you, yes, it's definitely worth it, it's going to help you, without knowing exactly what is it that you want to pursue or what your timeline is professionally.
Yeah, I was going to say, I would recommend looking again on LinkedIn or Mentor Network and typing in behavioral health, and maybe setting up like a quick phone call with someone that has pursued that program, because they can give you good insight on how beneficial they found the program to be. I would also recommend, if you have like certain job titles in mind, simply going on Handshake, Indeed, and looking at the requirements and seeing if the jobs you're interested in even require that specific degree, because sometimes you don't need the degree, you need a certificate. Sometimes you don't need the degree, you just need additional work experience. It honestly varies, so it's hard to give a sweeping answer, but I think doing some of that front-end research can help you decide if it's worth it, but especially talking to people that have gone through that program. And as far as predictions, just to add on, I think, being in the healthcare profession, there's always such a demand for those jobs. Post-COVID, I think there's obviously even a more greater demand. I think you are going to see a little bit of like burnout with healthcare professionals, to be honest, and I think there's going to be even more of a demand to fill those positions. I think there will also be more virtual consultations and healthcare screenings that will be implemented. I guess we're really all speculating, but I wouldn't be surprised if that's infused into the experience of, going to a healthcare provider. If you wanted to know about healthcare titles or career paths, how would you go about it? So one helpful website is on ONET. It's spelled O-N-E-T. It's a government website that is essentially a database of all the different jobs in the United States, and you can type in dentistry, for example, and it'll load a ton of different job titles that fall underneath that word. Again, I mean, not to beat a dead horse, but LinkedIn is helpful if you're wanting to know what some of our alumni have done with certain, you know, titles. If you typed in healthcare, it'll pull up nurses, surgeons, physicians, so you can kind of see that breadth as well. But I think ONET is a good place to look as well.
Yeah, the one that I also find helpful is let me see, I don't want to give you the wrong link, explorehealthcarecareers.com. So that one is another one where you can be very general and say, I am willing to spend 8 years in my education. I am willing to do a doctoral program, a master's, or only a undergraduate degree. And I want to be able to make the salary range. And then the system would actually give you a list of opportunities or careers that would be available to you based on the criteria that you have selected. So that is an option if you're looking for titles or anything like that that match your education level, but also your experience.
If there's any last few questions, feel free to drop them in the chat. Or if you want to meet in a one-on-one appointment, we'd be happy to do that as well. But yeah, thank you all so much for your time.
Awesome. Thank you all. We'll see you later.
Thanks, everyone. Have a great day.
Bye-bye.